we have many models of chronic illness. I think one of the more useful ones is the idea that persistent low-level inflammation is often driving it. And we can see this even in things that people don't think of as chronic illness, but heart disease is a very good example. Diabetes, Alzheimer's, these are all illnesses that appear to be driven by chronic low-level inflammation. I mean, when you measure many of the inflammatory markers, they're normal or only slightly elevated. But their persistence over time causes some of the cells to stay in cell danger response, whether it be 2 or 3 often, or sometimes even, or groups of cells. Because the thing we have to remember about the cell danger story is that it's not necessarily happening throughout your whole body. It can be happening in only part of an organ. And so if you have persistent inflammation that's low level in part of the brain, it's enough to cause stress. And if you don't have the right genetics, you're not able to modulate and turn it down completely. You can develop, since many people, myself included, think that Alzheimer's is an inflammatory illness, and the same thing can be said for, I think, almost every chronic illness, that it's chronic inflammation, and it's not a question of the immune system being broken. It's just dysregulated. I think that's one of the important points that I really want to make, is that people talk about having low immune systems. Now, we do have some illnesses where there are low immune systems and people require immune support. But most of the time, it's a problem of immune dysregulation, that you have cell types that aren't talking to each other like they should. And so it's not a matter of, boosting the whole of everything. It's a matter of restoring communication. And that's, again, we come back to, I think, the flavor, which I think would be the underpinning of everything we talk about in health today, toxicity. Because the environment that we live in today is different than it was when I started practice.